Well, what a lovely week of weather it's been. We've been so lucky to have some sunshine after so much rain here in Cork and Kerry. Here I am at the Scheduled Care Workshop at a wonderful new facility we have in Tower. And we're really working very hard to open this to patients. We're talking about all the actions we need to take patients off the waiting list and make sure people get their procedures, and all in line with the staunch care requirements. Well, last week I concluded with a really good conversation nationally with the National Communications team about the importance of internal comms and also making sure that we tell the stories of all the great services that we're providing out there to our communities. We also had the opportunity to have a national conversation about patient flow at the first meeting of the Patient Flow Academy, because we really need to work with our colleagues nationally on these issues. At the weekend, again, another busy weekend of working to make sure we had good care across the weekend. And you know that I really want us to move towards 7-day-a-week care in all of our sites. There's also an opportunity to work and meet with and build relationships with all those colleagues who are out there who are working on emergency services. So police, ambulance, fire, Coast Guard, Army, Navy, all those services. Really good opportunity to build relationships with those colleagues. And then on Sunday it was to Kinsale for the Sea Sunday service, celebrating all the work that's done across our services to keep people safe when they're at sea. Monday started with the review of emergency medicine, and we were challenged by colleagues at that meeting to say, well, what are the actions we're taking following the unscheduled care meetings? I also had the opportunity on Monday to go and talk to those wonderful people at Marymount University Hospital and Hospice about the wonderful services they provide there to our communities. And I was really struck by the real care and compassion, really living all of the HSCP values that those colleagues have. Later on in the day, I was having a more strategic conversation with people from Apple and talking about the sort of partnerships that we might have with industry, and particularly with Apple, and how we can use IT more effectively across our services. Another conversation a bit later on in the week was around our non-pay budgets, and we know we have to work very hard to make the most effective use of our non-pay budgets, and we may well see targets set for reduction of our non-pay budgets, and we want to make sure that those don't impact on services at all. Also, yesterday I was privileged to go and talk to the people at Mercy University Hospital about all the great plans that they have to build new accommodation across the system, and really again just follow up that work we're doing on the discharge lounge, talk about some other options they have for inpatient mental health care. Later on in the day I went off to CUH to talk to our hard-working health and social care professionals and really talk about some of the challenges and how I might help them with those. In the evening yesterday, a great opportunity to celebrate all the work that's done by a large number of companies, including, of course, our own HSE services, around staff health and wellbeing, and particularly mental health and wellbeing. So it was great to spend a few hours there last evening. Well, today, another great day. At the end of today, I'll be going to work with Ernst Young and have a conversation with those about how we better do national planning of population health. Well, again, thank you so much for everything that everybody has done. Looking forward to coming out and visiting you again next week.